So the plan for today is to remove these grafts, and we will use a small 0.7mm punch to extract these hair follicles that were previously transplanted too low into the muscle, and then we will reuse this hair further back to densify and create a more natural hairline for him higher up, that is in keeping with his facial features, his frontalis muscle, and also the temporal peaks, which his natural temporal peaks just come up, and this frontal temporal angle needs to be recreated so his hairline looks much more masculine. At the moment there's grafts in areas which anatomically are causing a very unnatural appearance.